Hi, this is Weinberg. This video intends to show you the correct way to wear a face mask and how to dispose them safely. Face masks can provide effective protection only when you know how to handle them correctly. Before putting on a mask, always make sure to wash your hand thoroughly and correctly. The first step of putting on a mask is to make sure the collar side facing outward and the metal stripe on the face mask stay upward. Next step is to hook the face mask to your ears. Next, to pull down the face mask, make sure it covers your nose, your mouth, and your chin. The last step is to press down the metal stripe to make sure it fits the shape of your face and the nose bridge. Then you are correctly wearing a face mask. To take off your face mask, always keep in mind that the outside of the face mask is already contaminated, so you should only handle the string. If you have been breathing with this face mask for a while, you need to discard them. Again, make sure you don't touch the outside of the face mask. By handling the string and the inside of the face mask, you can roll them. After a couple roll, the entire thing will be covered with the inside of the face mask. Then you can fold them in half. And the last step is to stabilize with the string, like this. After that, you should put them in the plastic bag, spray with a disinfectant. That can be alcohol, that can be chlorine-based disinfectant like sodium hypochlorite or hydrogen peroxide, anything like that. For N95 respirator, they may wear differently, as there are two types of design. The first one shares the same design as the surgical mask, which has the ear loop. Then you wear them like a surgical mask. The second type is like this. Design like this allows you to tie them around your head, which is more comfortable. What I have right here is a European equivalent N95. The standard is FFP2. I will talk about standard later in this video. To put on a mask like this, you pull the string and tie it around your head, adjust the position to make sure it's comfortable. And the position of the face mask is the same as surgical mask. You should make sure it covers your nose, your mouth, and your chin. The last step is always to press down the metal stripe to make sure it fits the shape of your face and your nose bridge. To take off the respirator, again, keep in mind the outside of the face mask is already contaminated, so you only handle the string. Like this. If you want to dispose it, go straight to the plastic bag and spray with disinfectant. A little more about the disposal of face mask. After you put them in the plastic bag, you need to seal them or tie them, and then label with marker saying contaminated face mask or used face mask. If the place you live in practice trash classification, then they should go with hazardous waste. There is one thing about N95. The one I have with exhalation valve is not recommended in the outbreak because the exhalation valve can be break, so the unfiltered air may leak into the respirator, and if the air contains droplets of infected people, then it will cause infection. Secondly, if you are infected, then if you wear N95 like this, the breath you exhale will not pass the filter and going out through this valve directly. That means you are spreading the pathogen to the surrounding, and that may be dangerous to the caregiver and including your family. For standards of face mask, you need to know both surgical mask and N95 can provide efficient protection against the recent COVID-19 coronavirus. For surgical masks, you need to make sure it fits the standard of ASTM F2100 Level 2 or Level 3. That's a United States standard. For N95, you need to make sure it's approved by CDC or National Institute of Occupational Safety and Health, aka NIOSH. If you purchase the respirator in Europe or you live in Europe, the equivalent N95 standard is FFP2 and FFP3. For medical professionals, FFP3 is recommended. If you live in Australia, the N95 equivalent standard is AS1716, and the Japanese equivalent standard is JS-T-8151. Lastly, about the timing to replace a used face mask. Both surgical mask and the N95 are expected to change regularly. For surgical masks, there are 3 conditions means you need to change a new one. First, if your surgical mask is visibly dirty, you need to change a new one. Second, if you have been breathing with this surgical mask for accumulated 4 hours, then you need to replace with a new one. Third, if the surgical mask is damped by moisture in your breath or damped by any liquid, you need to change a new one because a wet surgical mask cannot provide protection. For N95 respirator, you can breathe with it for a long time. There is no certain hour as an indicator saying you need to change it. But if you feel abnormal level of difficulty to breathe, then you probably need a new one.